welcome to today's Provider Podcast. My name is Jim Dunn. I'm the Medical Director for Microbiology and Virology here at Texas Children's Hospital. I'm pleased to join you today to provide you with some updated information regarding our current respiratory virus season. We've seen quite a number of RSV cases this winter here at Texas Children's. I think we've reached our peak as of this date, and so those cases are beginning to wane. And more recently, we have seen a little bit of flu activity, but at this point, it seems to be fairly minimal. We're only seeing perhaps a handful of cases here at the medical center. Both influenza A and influenza B have been detected. So with regard to some of the point of care testing for rapid flu and RSV diagnostics, I wanted to mention a few points that might be appropriate in the outpatient setting. First of all, with these rapid point of care flu and RSV tests, we know that they're really most appropriate when those viruses are actually circulating in the community. So if we're testing for flu and perhaps even RSV in the middle of the summer, for example, we know just based on the inherent performance characteristics of those types of tests that the predictive value of a positive result in the middle of the summer for flu is almost zero. So that is most likely a false positive result when it comes to rapid flu testing. So I think they're most appropriate when we use those once we know that flu is circulating or once we know that RSV is circulating in the community. Once the prevalence of those viruses increases sufficiently, then we can predict that the assay will be more accurate and the predictive value of a positive test is much greater once we know that virus is circulating in the community. The other important aspect with the rapid flu and RSV testing is that historically those assays have been fairly insensitive in detecting certain flu and RSV strains. There's been some improvements in the technology in recent years with automated readers and such that are available with these assays. So with the increased sensitivity with some of the newer flu and RSV antigen detection assays, it's also important to know that these assays have the potential for detecting the viral antigen that can persist in some children for several days, perhaps even a week or 10 days beyond when they're initially infected. So if they test positive when they present to the clinician and get a little bit better on perhaps an antiviral for flu, but then develop respiratory symptoms subsequently and get retested, it's possible that there still may be influenza antigen present in the respiratory secretions with these newer assays. The other important point with these types of tests to note is that they really are intended for testing only symptomatic patients that have respiratory symptoms compatible with flu or RSV infection. They're not meant to be used as a screening test, for example, to determine whether an asymptomatic individual is perhaps harboring the virus. We really don't know how the assays perform in that setting, and they're not really intended for those purposes. More information regarding the epidemiology of the respiratory viruses that we've been seeing this winter, including influenza and RSV, can be found at the websites that are listed below. Thank you for joining us on today's podcast. We hope you found this information useful, and please look forward to future presentations on a number of other topics. Thank you.